Welcome everybody to the Personal Health Summit 2015. Thank you so much for investing the time into your health and your happiness to be here having these great conversations with us with 30 of the world leading experts in all areas of health. Today I'm super excited to be interviewing Clint McLellan, who's going to talk to us all about the advancements in biotechnology. So first of all, thank you so much to our major sponsors, Ultimate Human Foundation, for the amazing work that they're doing looking at reversing and preventing chronic disease and pain for the future of humanity. Thank you so much to PH360, who's looking at the understanding all these personalized health insights in epigenetics and how this can apply to our lives so we can really start to tangibly understand what's right for us and good for us to be eating, to be moving, to be thinking, and all the things around us in our life that is really important at this point in time. So please check that out, onlinehealthsummit.com/PH360. And of course, the biggest thank you to you for being here and investing your time into your own health. So I'd love to introduce today, I'm very excited to introduce today Clint McLellan, leveraging 15+ years as a wireless health executive. Clint's latest venture, Indie Health, helps companies deploy the most innovative connective health services in the industry, working with best-in-class partners to deliver state-of-the-art products and services for independent living and individual empowerment. Clint most recently co-founded the original wireless health group in Qualcomm, which eventually became Qualcomm Life, and prior to that established Qualcomm's global industry analyst and global market intelligence program. A very, very smart guy, this one. Clint has served as the president and chairman of Continua Health Alliance, where he led the efforts to get the Continua standards adopted by the United Nations standards body as the world's only connected health standard. He also served on the boards of San Diego Telecom Council, ComNexus, and as the board chairman for the Foundation for the Children of the Californias. Clint, super excited to welcome you here today as a leading expert and authority in the fields of wireless health, of biotechnology. Thank you so much for joining us.
Oh, it's my pleasure. Thanks for inviting me.
No worries. Well, Clint, I'd love to just jump in and hear a little bit more about you to start with, about how you ended up in this field, about what really drives you or what you find inspiring and exciting about biotechnology. It certainly is an area of fascination and interest for me. I'd love to hear a bit about you and for your perspective for the listeners today.
Great. So I've been in the cellular industry for about 20 years now. I started off as an analyst back in the very early days and then ended up going to Qualcomm probably 15, 16 years ago. So my background has always been communications. And within Qualcomm, 6, 7 years ago, we wanted to figure out how do we get involved in the healthcare market? And what we found is that connectivity was a very difficult piece. If you think 4 years ago, no one knew which radio, low power radio would win to build connected systems to get biometric data to the cloud and onward to a health professional or back even to your own repository. So we started Qualcomm Life back then. And we built a platform with a cloud, it's an overused term, but a cloud along with a hub that would collect biometric data. So about 2 years ago, about a year and a half ago, when I left Qualcomm, I immediately decided that what I wanted to do was help build devices and partner with other third parties that could also get these services to market. We're entering an area where the connectivity is getting much easier. And so a lot of my work in Continua was to look at Bluetooth Low Energy and some of these technologies. So now I'm partnering with a variety of companies to help build connected health systems that are affordable. And really the big key here is scalable. That's the key, that we're just getting to the point when we can really begin to scale these systems and third parties can get up and running on their own.
Beautiful, Clint. Well, thank you for sharing that. And as you know, and as I mentioned just before, I'm fascinated with this technology and the fact that we now have amazing applications available. We now have, it's almost beyond our wildest dreams of things that are possible now with technology. Whether we like it or not, it's coming, and it's coming fast, and it's coming strong. Could you share with us a little bit about, from your perspective, where you see technology at this point in time? You've been around for a long, long time in the technology industry, and you're arguably pioneering a lot of the areas in telemedicine and a lot of other areas. Can you share with us, just how you see where you've come from, from 20 years ago through to where we are now, and what things are looking like coming in the future?
Absolutely. It used to be in the cellular industry that hardware was the most expensive component, expensive hardware to just make a phone call. We're at the point now in the industry where inexpensive hardware allows you to surf the internet. From a cellular perspective, it's uncommon for people not to have a smartphone, at least in the developed countries. So we're looking at that same analogy with healthcare, with health, where if you look at any one of your smartphones, any one of us might have 20, 30 applications on that phone, because an environment has been created, to what you mentioned, to get creative people to start building applications. Well, that same evolution is about to happen in healthcare, because the hardware is getting less expensive and easier to connect. So my vision, my goal, is to make the hardware the easiest pieces to put together, to integrate blood pressure cuffs, weight scales, activity bracelets, glucose monitors easily into a platform. Now what you do is you allow an application developer to take the hardware that's inexpensive and easy to connect and let them get creative and build their own applications. So I have a suite of partners to help with just about every facet of this. So we've got the devices, they're easy to connect, they're coming down in cost. I have a portfolio on my website that we're selling, but also to find other partners that have the other pieces. I don't have a tablet, but I know people that are either making custom tablets or use off-the-shelf equipment. So we're at the point now where the creativity comes from application developers, from people that have had ideas, but it's been too expensive to get the equipment and too onerous. So we're taking the equipment piece off the table, making it easy to allow this new creativity to come through. And I think one of the most creative components are patches that measure a variety of biometrics, all from a single patch. From the clinical perspective, to easier, less expensive devices like activity bracelets and others that can help measure activity and other forms.
Beautiful, thanks, Clint. And could you share with us a little bit about, for those of us who are in this, in this field, we talk a lot about the commonplace terms. Could you even back it up a step for us, for some of the listeners that are dialing in now that aren't as familiar with all this wireless technology and the wearable devices and all these fitness tracking devices that exist? You're talking about blood pressure cuffs. You're talking about fitness trackers. You're talking about patches. How does that actually work? Like, what are these things? How do they work? How do we apply them? How does this change the way that we've been looking at medicine or science in the past, and what's accessible and available and affordable now?
Well, the concept is that with this new, if you've heard of Bluetooth Smart or Bluetooth Low Energy, that is now it's very inexpensive to incorporate that into a blood pressure cuff, into a weight scale, into an activity tracker, into some of these patches. So we're able to access all this data easily, get it to a phone and to a cloud. And the key now is to correlate this information. Many people give up their fitness trackers after 3 months because you self-calibrate. After 3 months of wearing that device, you know what 10,000 steps is. But now we're allowing an environment where you pull in other biometrics. What is it doing to my blood pressure? How is my weight affected? How is my sleep affected? So from that perspective, you take these medical devices and you can connect them easily. But it's with these new generation of low power radios allows this development to begin to occur. Did that answer your question?
Yeah, that was a great understanding. Thanks. And just even delving into sort of where we start and some of the concepts people might have heard of, Fitbit and the old Nike Fuel Band, and now we've got like the Apple Watch and some other things like this coming out with devices. How does it actually work? Like, if I was wearing a watch, if I was wearing a tracker, if I had a blood pressure cuff on, what actually happens with that? Like, how does the information go from that to where does it go, and how does it get to where it gets to? Could you just walk us through the very basic steps of that?
Absolutely. So from the tracker is collecting and storing this data, the biometric data. So let's say it's an activity tracker bracelet like a Fitbit. You would wear that. In some cases, the Fitbit automatically uploads the data through Bluetooth Low Energy, or you hit a button to upload it. It goes to your phone or to a dedicated hub that has low energy Bluetooth and maybe 3G in it, or 2G even. Goes to the hub. The hub then sends it over the cellular network to a database. And that database can then be accessed by a caregiver, or you can access that again. But the real key to this is that you're storing trend data. So over time, you can go back and look and see how you've been progressing, or how your weight has been correlating with your blood pressure. And that's the real key here, is to collect trend data over time. So it's really a two-hop thing, from the device to the hub, then to the cloud. And then there's a dashboard there that would help you make sense of it all. Beautiful.
Thanks for walking us through that there, Clint. And that's it's pretty crazy where we've come and we're at this day and age, that we can just wear a watch, or wear a bracelet, or even rings and things like that are out these days, some patches on our skin. we don't have to do anything. We don't have to, go to our doctor and get our blood pressure measured anymore. It just talks to our smartphone. And so we have, we just wear these things. Suddenly there's this information on our phone that ends up in this portal that we can look at any time. And as you suggest, look at our data over time, that, maybe this is how many steps we took and this is how it changed over the months, or this is how much sleep we're getting and how that changed, or this is even now, there's devices out there, right, for like, blood pressure, for blood sugar levels, for cholesterol, for stress, for sleep, for so many different things, biomechanics. And it's really an exciting time to see that we don't, as I guess as general people, all we have to do is put our little device on and suddenly we know so much about ourselves. Could you just share a little bit with us maybe about this concept that people may have heard of called, the quantified self, or the quantified self movement? I know it's a big thing in California where you are. The rest of the world may not have, may not be on that same bandwagon just yet, but I know there'll be a lot of listeners here that have either heard about it or are very interested in it. How is this changing the way that we understand ourselves, our health from a medical point of view, and how we're able to really, harness that information and make things more efficient and affordable and accessible than ever before?
Well, that's a good question. So the quantified self movement to date has been very motivated individuals, mostly athletes, that buy the devices, they collect the data, they manually input it, they take all the trouble, because it hasn't been easy to connect to date. So they collect this data on themselves and are able to watch their values over time, their biometrics. But so now what's happening is healthcare professionals and other entities are getting interested in this to collect data on those of us that aren't as active as we used to be, that are getting a little bit older, and to be able to help us manage our health. The quantified self was very user-driven, and you had a lot of IT hurdles you needed to overcome, but these were very motivated people. This next generation is to collect data and help people who might not be that motivated and are not that tech savvy, but that's actually okay, because it's getting easier to build these systems. So the new quantified self is almost the passive quantified self. You might just be collecting this data over time, and what it could be is like the black box of an airplane, where you have all this data coming through, and then when something goes wrong, you can go back and look to see what might have happened. So you suddenly realize that your blood pressure is high. Well, let's go back and look at what my activity has been like over the last year, 2 years, 6 months, whatever that might be. What has my weight been? And so it's this type of activity that will become commonplace with all of us, because it will be easy to collect. As a matter of fact, I'm in Santa Barbara right now, and I'm going to visit with a company tomorrow that's using the phone to collect data to help manage mental health. The activity tracker on the phone, your activity on the phone, your email, the language you are using, these algorithms will be able to collect that and collect over time your mental health state. And then there are surveys you can take as well. So that's the missing piece, I think, when we talk about the quantified self. It's the mental quantified self. But the beauty of this is it's passive, in the sense that the phone is collecting a lot of data. Many companies are looking at this, but I think the one I'm meeting tomorrow might have done the best job I've seen so far. And that will be correlated with the rest of the biometric data.
Wow, it's really exciting times, Clint, and I really appreciate you being here today to share all this information with us, because there's a lot of great comments coming through. I'd just like to have a little interlude there just to say this is an interactive session. If you have questions for Clint, if you'd like us to engage, feel free to raise your hand and join the conversation, or post your questions down the side in the chat box there, and we'll do our best to get to most of those questions throughout this talk. So Clint, it is a really exciting time. I know, for us, we've been obviously been known each other for quite a while, and had some great conversations about technology over time. There's some great things out to measure people's brain waves, to measure people's foot strike on the ground, to see how the biometrics the biomechanics work. You talked about some patches that can measure lots of different medical side of things. It really is just an exciting time to be in this space, and to understand that even though we've got a lot of great conversations about that we've had on this summit, actually, about mindfulness, about consciousness, and about people even talking about getting back to more nature and less away from technology. Right. Technology is certainly here to stay, and it's actually something that we can really use to harness a lot of this new information to help us with our health and help us end up in the same space. And I really see it as a very joint conversation that everybody's on the same team here, as long as we can understand the direction we're heading in, and that we're doing this for all the right reasons. That it really is a huge advantage that we've got with the smarts that we have as society these days to be able to create this great technology. I'd love just to hear a little bit more about some of the applications you can see in everyday life. You mentioned that you've been involved in a lot of different wearable technologies and wireless technologies. I know you talked about some of the basics that people can start with. I know there's a lot of fancy headsets you can wear to measure brain waves, but for most people listening in right now, where can we start? You measured this, things like scales that you can actually take your weight on regularly, blood pressure cuffs. Can you tell us a bit more about what what's available right now in those forms, and if you've got any information about where you're actually working, where people can find that out? We'd love to put some things here so people can check that out.
Yeah. So right now, just making it easy to collect weight and blood pressure is a huge victory for the industry. But to your point, what's next beyond that? I think what's next is going to be from the activity tracker. They're getting much more sophisticated, but much less expensive. And so from that perspective, I think what we will end up doing, the new trackers have these LED light diodes that collect heart rate variability. So here's one of the new factors, and I'm not a physiologist. You would be a much better expert to actually comment upon this. But with heart rate variability, you're much better able to measure stress and also real sleep quality. Those are the two things, to your point about mindfulness and some of the others, that we need to learn how to get control of. Even if my blood pressure might be in control, how is my stress level? Okay, so you still have cortisol and some other chemicals that are built up. So if I'm stressed, that's still not a good thing. So the next thing, I've only joked about this, and don't laugh when I say this, but we talk about M health, wireless health, really M for the mobile, M happiness. How do you feel? Okay, your blood pressure might be in line, your weight might be in line, but you don't feel good. So we can measure that. And then I think we can work on ourselves. We can actually, the healthcare system is you and me, and it's everyone online. We need to take better care of ourselves, or know how to take care of ourselves and our loved ones. We can't rely upon a system anymore. I just got my first checkup in about 5 years 2 weeks ago. Luckily, I came out with flying colors. I didn't think I would, but I did, which was great. I've been traveling a little bit too much. But I asked this doctor, what would you think if you could collect all this information? In the US system, in the fee-for-service system, he's not paid to collect it. He said, that's nice. That's nice if I know your blood pressure before you come in and I see your trend data, but I'm already overworked. So all of this information, it has to be inexpensive, it has to be passive, and much of it has to be utilized by ourselves to improve our health. But this is where the application developers come in, the clever folks. They're going to figure out how to take this data and tell us what we might do with it.
Beautiful, Clint. Thank you so much for sharing that. And I think you touched on such a great point there, where these exciting times that are coming forward, it really is changing a lot of the way that we see our current system, and the way that we interact with our doctors or health professionals so far is certainly going to be a very shifting landscape in the next 10, 20 years. And this is a very hot topic of conversation in the fields of wearable technologies and mobile technologies and wireless health, because it is empowering us. And this whole summit series is about us, about empowering ourselves to understand that we have all the power to control our own health, to choose what's right for us, to choose the way we think and what we eat, and all these sorts of things. And if we can understand where we're at this point in time with all these great devices that can help measure that, it means we're empowered to make choices in the right direction. Maybe we aren't aware of the fact that our brain is in a different state, or that we're low in certain vitamins or minerals, or that we may not have had enough quality sleep for the night that helps us perform properly the next day. And these sorts of devices and technologies are able to help us understand that. And most importantly, it gives us the power. We don't have to go and rely on a third party or something. We can actually start to understand this information ourselves. And you described so well that when we've got some great software and applications around that, then it really is bringing all this information to ourselves, so we can actually choose to make these good decisions about our health. So I really appreciate the work you're doing in certainly leading the charge in this way a lot. Have you got a site that you can give us, Clint, for people just to check out while we're talking about this, that we can pop in the conversation here?
Yes, it's Indie Health, INDIE-health.com. And this is the first solution we're working on, which are devices that are open standards based, that are very easy to integrate to allow third parties to develop. That's the first piece, and we'll add to that portfolio.
Beautiful. Thanks, Clint. And for anyone who's wanting to find out more about this, if this is a new conversation to you about wearable devices and biotechnology, please go check that out. If you're very well versed in this, I'm sure you're enjoying this conversation. You probably heard of Clint before. I'm sure if you've been, Clint's been around the place a very long time as a leader, and certainly appreciate the work you do in this space, Clint. So just transitioning a little bit to some of the applications here towards our health, Clint, and once we actually have this information, this data, what's possible for us now? Where do you see things going in the future? And we talked a lot about just a minute ago about how this is going to be shifting the power back towards us as the person on the street, and not so much relying on our providers or insurance companies or even our health professionals as much, because we have the data that we can take and run with. How do you see this working in to the future, and what's your sort of if you have any predictions for us with the people that you've engaged with as to what you see coming?
I think a lot of it, researchers will be able to take this information and then feed us back information on a population basis. What happens when you can take lots of this data and look at it? So that's one exciting thing. We've never had this much data before. I mean, generally, I think your general population has 2 blood pressure readings per year if they go to their doctor. So now we can begin to look. Blood pressure, the 120, I'm not a clinician, but 120 over 80, the classic number, was determined in a study, I believe, 40 years ago. And so now, what do these numbers really mean? Instead of from one clinical study done at one point in time, what can we do? So that, to me, is the most exciting piece, is the research that will come from this. Now, there are all kinds of data rights I'm not going to get into, and that's always a hurdle. But I think that much of this will be used from that perspective.
That's beautiful. Thanks for sharing. It really leads into, again, the reason why we're here for the summit. It's all about personalized health. It's about understanding that all of us are very different. We're very unique. The standard blood pressure 120 over 80 is actually very incorrect for many of us. That's just a very general average from many years ago. In fact, decades ago, as you share.
Right.
So what we're able to achieve now is understanding, if we've got a lot of data that's collected from millions and millions of people around the world, in fact hundreds of millions of people, we can start to now understand, even without doing expensive research studies and all these sorts of things, we can now start to understand what is a normal range, or what is the average that should be there, and how's that different for each person. And we often talk in a medical capacity about the difference that everybody has a different blood pressure level that's normal for them. Some people being low on the 120 over 80 is normal for them. Some people being high on that is normal for them. And same with cholesterol, and same with blood sugar, and same with all these other things that we're now just learning in personalized health, that we're all different. And it's a great time to be able to understand that technology is bringing us so much of this information, so we can actually change the way that we view things. We can change the way that we're practicing from a medical and health point of view to say, oh, hey guys, we've been operating for a long time off of this old model of general averages, based on population science. But now we actually can understand that it's a personalized conversation. And you know what? People are wearing devices, measuring their own personal data. We actually have the information. We can make a lot better decisions. We can have much better conversations to get towards a place of health and happiness for this planet. And that's really why we're here having all these conversations this summit. So I really appreciate the perspective that you're bringing, and the way that you've been leading that charge, again, in technology, to be able to bring this information to us so that we can have these conversations in a larger capacity, and start to understand more of the term big data, all this this whole wealth and the whole volume of data that's being collected now for each person, so we can start to reason through and help understand it better for ourselves coming forward. So Clint, I'd love to bring it back to looking at our health and how you see things from a technology point of view, really the connection between the health technology, or the health biotechnology that exists now, all the things that you're involved in, you're talking about, and how that actually relates to health outcomes. Have you got any sort of inside information or any insights that you can share with us about how technology is actually improving in our health outcomes in any capacity?
Well, I think that I look at it a little more pretty basically, in the sense that the one component that I think has been found over and over and over to improve health, whether you're in your 20s or 30s, you have chronic disease, or you're already healthy, is activity. And so I think that's what we need to focus on. And I think what's going to happen in the next phase of this quantified self piece is to tie that to mental health. And it's the smart people that are going to be able to tie all this together and potentially make recommendations, or at least tell you why you might be feeling that way. So it'll go back and look at your activity and look at some of the other components. So that, I think, is between that and sleep. I think those are the pieces we really need to nail. So and of course, there's personalized medicine and looking at your genome and all that. That is fantastic. But we need to figure out what we can do ourselves within that. What can we control? So it's going to be between, once again, how can we nudge people? A lot of this next change is going to be behavioral to make people feel better. And if you're 20 pounds overweight, but you feel good, maybe that's a winner. You know, we have all these, to your point, we have all these ideals, but we don't know what's right for everyone. So I think that's what we're going to learn, and that's what people will learn. And it's the smart algorithm developers and application developers that will figure out. And I think a lot of it is called a nudge. Behavior change is difficult. What can you find? What can you take between your activity and your diet and your sleep? What can you do there to feel better? What is it that you can control and is under your control? So I think that's going to be the art, to show people that and show them how they'll feel better.
Beautiful. Thanks, Clint, for sharing your perspective and insights there. And we're going to jump to a few questions here. We had heaps of questions and comments coming through. I've been talking, and we're going to probably cover some pretty crazy things here, I'm sure, in the fields of biotechnology before machines take over the human race. But we've got a question here from Vic that says, do you think we'll ever be able to program our apps to areas of personal issues? We have blood pressure and heart rate, but will we be able to track something like our thyroid or adrenals? Could we get to choose what we track? It's a great question, Vic, and this is now sort of projecting into the future. I'd love to hear your thoughts or insights or anything that you have in this area. Great question. Thanks, Vic.
That is interesting. And the way, I don't know that you could track that specifically, but I think what you want to do is find out, what does that affect? What can you track easily that affects that? So maybe it's sudden hydration we're able to track, for example. Glucose readings we're able to track, at least from there's continuous glucose. Maybe the thyroid is a combination of something that we can look at that at least gives us a symptom. So maybe not exactly, and I haven't heard anything on that specifically, but the key, if we wanted to measure that, what can we measure now that would give us an idea that might be happening? And then the patient, if they do have a thyroid problem, might learn what those markers are within what we can track. Does that make sense?
It does, Clint. Thank you. And I think there's just so many different ideas that may pop up from lots of people in this conversation. There's a lot of amazing areas of development in the whole wireless and mobile health industry of great ideas, just amazing things that people are thinking of and bringing together. And it almost blows your mind when you spend time in this space still to see what's possible. It really is phenomenal. And it was many years ago that we were that people may or may not be aware of. It's been many years where we've been wearing these helmets and just thinking about things and flying remote control helicopters through hoops and landing them. And this is very old news in the health tech space, but still very crazy for those people who haven't heard about it. We're talking about lots of things like 3D printing and the fact that from a medical point of view, where we're most interested in 3D printing of organs, of blood, doing transplants, and a lot of different things like that. Even 3D printing of DNA, which is a conversation we probably won't get into on this call. But there's a lot of things that are coming out that people are either unaware of or just starting to learn about. That really, it's not a crazy Star Trek conversation anymore. These are real conversations that are happening right now. It's an amazing time to be alive and to be in this space. So I'm sure you don't have too many boring days, Clint.
No, there aren't many, but mine though is focused on what sound like boring things, which is just collecting the basic data, because we just haven't been able to do that well enough. And then building from there to what you're talking about is absolutely going to happen. I mean, I've already heard of people with 3D printing. There's some remarkable things that are going on with organs and the EEG waves as well, on how we can actually measure, again, mental state, and all of that needs to be. The key is to collect a lot of that data and actually store it and be able to use it over time. That's the real. Sometimes it's those boring things, collecting it and making sure it's in a standardized way that a lot of people forget that is the most important building block. And I've been focused on a lot of those boring standardization pieces, which actually allow this. But again, I mean, that's much of what I worked on is really the ability to connect them easily. So that's kind of the art of it all.
That's beautiful, Clint, and thanks for sharing that, because we do get a bit carried away sometimes with the future Star Trek-y gadgets. But again, bringing this back to why we're here, it's the tangible things that we can do to make a difference in our own lives. Very, very easy. We can all hop on a scale. We can all put a blood pressure cuff on. We can all have a bracelet that's on our arm in a very, very easy way, and it's very inexpensive these days. Very inexpensive. to be able to do this. And it means that you can understand a lot more about yourself, a lot more about your personal health situation and how this applies to you. And I will just mention here, because it's, we've got our major sponsors, PH360. I know that they're working in a great way to bring a lot of the technology and incorporate that into what they do. And there's a site that you can check out, ph360.me/crowdfunding, where they're actually looking to continue the development of the technology that they're bringing into it. That's going to be a great thing where they can actually talk to you. The app will be able to talk to you in advance and integrate a lot of the wearable technologies that you're talking about there, Clint, to be able to give you advice in advance for food recommendations and for going to the gym or putting your shoes on to go for a run. And a lot of this very intuitive, predictive, interactive technology that talks from your phone to you, so it can actually think in advance before you even have to get there, to be able to help change your health as you suggested, because that's one of the hardest things that's out there. So if you're interested in that, please check that out as well, ph360.me/crowdfunding. And that's some really exciting things that they're working on, as well as many of the other amazing things that are out there too in the world floating around. But bring that back to the conversation here. Please just take note, if nothing else from this call, be aware that these things are available. Check out Clint's stuff, indiehealth.com. Even just a simple bracelet to track some of your activity, to talk about heart rate variability, as Clint suggested before, which is a really powerful indicator now. We have a lot of science behind this. The guys at HeartMath that we talked to Roland McCrady earlier in this series, the guys out there are doing a great job with really helping us understand more about that and linking that with our moods and our behaviors and even our thoughts, and how that can actually change things. One of the, just on this, one of our great companies we support, Biometrics, they're doing some great things at looking at taking some of this data and interpreting it and finding out if you're in a happy state or a sad state, and actually using that information from your heart rate variability to bring that back to your iTunes library, your music library, and then selecting a song that will play to either if you're in a sad state to make you happy or whatever it needs to be. So this is the implications of technology when these apps are being developed, and it's really exciting time and space to be in. But the basic health fundamentals, Clint, the work that you do is the most important out of all of this, and it really is a great time to be having these conversations. So I'm going to jump to a few more questions here. There's a lot of questions, and just on what you talked about there, Clint, I'd love to get your thoughts on this, because a lot of us have no idea about this, and it's a great question here from Nancy that says, are health professionals using capabilities of these devices to improve diagnosis and healthcare? I'd love to hear about, is this actually being used? Is this just crazy people in the lab that are developing this stuff, or is it actually being used by doctors or hospitals, or being rolled out? Is that in America or all around the world? Can you share a little bit about that with us?
Sure. I think they're actually being rolled out around the world. Quite a few in Europe. China is beginning to pick up, and much of it is the business model when you look at healthcare professionals. And so in the US, there are insurance agencies that are beginning to look at these. It's only been in the last year that the interest has really been picking up, because it has been easier to deploy, and there are many third parties out there that are beginning to do this. But probably 2 years ago, the French government was, the hospital system was putting out tenders for healthcare for chronic care kits, blood pressure, weight, and they were one of the first pioneers to then want activity in there, because they want to watch to be able to see the activity of these patients, because that's the best indicator of our state, our mental state, and of our physical state. If activity goes down, something's going wrong. So there are pockets of systems that have begun to do this, and certainly in the U.S. there are capitated healthcare plans. What capitated means is that the hospital is also the insurer, and they actually need to be able to keep you out of the hospital. They want to keep you healthy so that you don't incur hospital costs. Those types of systems are beginning to look at this, and this has only begun to really in this last quarter, I would say, or the last 6 months. But all the partners I work with are all getting tremendous interest. There are clinical trials going on using these systems, so that as you have a drug out there, you know how it's affecting behavior, glucose levels. And one of the popular components I have that we're marketing is a low-cost activity bracelet that it ties easily to a platform, because people want to look at behavior change. How is my program working to get this person more active? So it really is not, it's starting to take off. And in China, there are also, corporations have their own hospital systems. And so those systems want to keep people at work and out of the hospital. And so those systems, there's lots of activity there as well. But I would say it's probably in the last 6 months. So I think in 2016, you'll really begin to see more and more of these take off.
Beautiful. Thank you, Clint, for sharing that with us. And I really enjoy these conversations about where this is going with health and how we're starting to harness it, where we talk a lot in different conversations about our mind and about collective consciousness and all of us being connected. This is a conversation where we are all starting to be connected. It really is the power of the internet. The power of technology is really having us a lot more connected with ourselves, with each other, and pulling this information together. And it's pretty exciting to see where the future is going to go with all of this. We've got a lot of comments, a lot of questions coming through. We're just going to jump to some of these. Got a great question here from Nancy, who says, Clint, how useful is the data I get from these devices if I get it all from an unhealthy state? The last time I was healthy, these devices didn't exist, so I have no reference range for what's normal for me. That's a great question, Nancy, and Clint, I'd love to hear just the insights on this for a lot of people that are in this situation, maybe just starting out. It's been a while since you've been healthy, and this is taking a first step forward. Maybe you want to go check out indiehealth.com and have a look at some of the activity trackers or the scales that are there, so that you can start to get some data on yourselves and start to make a difference. Clint, how is this data useful when you're in a state of non-health versus health, and how do we use these trends over time, as you suggest?
Well, that is a great question, and I'm going through the same thing. I suddenly realized I was so much more fit 5 years ago. What on earth happened? And so we're all learning our numbers, and so it is a shame that we didn't have these 5 years ago, because 5 years ago I was still 185 pounds, but a lot healthier. So now I'm the same weight, but things change over the time, over 5 years. So now I think the key is just to get a baseline. Get as many components as you can, and more connected systems will be coming onto the market over the next year or so. But get a tracker, get a weight scale, get a blood pressure cuff, and start to get to know those numbers now, even if they're not connected. And so right now the products I'm using aren't yet for the mass market. They will be soon. I'm selling mostly to systems that are building these, but I would say at least get a blood pressure cuff and get to know those numbers. Get to know what's healthy, get to know what's you, and if you can improve it, get a baseline now. I think that's the real key to get started.
Beautiful, thanks, Clint. And I would certainly echo that, is that if you don't know, if you like, as Clint just shared, been to the doctor for the first time in 5 years, go and get some data on yourself, guys. Make sure that you do have these baseline measures, because what you get now will certainly be helpful, very, very helpful in the future to revert back to have some comparison data, to know more about yourself and who you are. But it's also helping you understand a lot more about your awareness of your physical health right at this point in time. And as we talked about on so many of the calls here with all the experts, whether it's food, exercise, nutrition, whether we're talking about mindfulness or compassion or happiness, it's about being aware. And the first step is, if you can be aware of who you are and where you are at your current state of health, whether it's mental health, as Clint suggested on this, whether it's physical health, our biometrics, our physiology, whether it's emotional health. If you can get some awareness around where you are at this point in time, it means you can actually start to do something, because you know where you are and you know where you want to get to. And so, I very much echo those words, Clint, and really appreciate the fact that this information is now available very easily, very accessible, very inexpensive. Go to check out indiehealth.com and find out more about this sort of stuff. We've got a really great question here from Dan, and I'd love to see your answer to hear your answer to this, Clint. Dan says, Clint, if you could develop any device right now, not limited by current technology, what would it be?
Gosh, I would love a bracelet, a tracker that measured all the biometrics that this patch coming out very soon will measure, which is hydration. It's hydration. It's heart rate variability. It's all the basics. That to me would be the perfect device. One piece that you can wear that will pull all of this in together. We're not there yet, but again, I'm trying to look at it from a simplistic way. What can we simply do that will have the greatest impact? So to me, that would be a nirvana. And also, I think being able to measure blood without taking a prick or having to go subcutaneously, that to me would be the ultimate device, because we all should know our blood sugar and we don't. I have no idea what mine is. So many people creep into type 2 diabetes. It's horrific. So that to me, from a public health perspective, would be one of the greatest measures. We always talk about full-time blood pressure readings. That would be nice, but as we said earlier, our blood pressure varies all the time. But what are some really meaningful components? So the minute you see yourself with type 2 diabetes, I think that would be one of the greatest improvements to public health right there.
Beautiful.
Does that answer the question? I don't know if I did or not, but that to me would be remarkable.
I think you did a great job, and let's hope that we can get to that point in time. And I know that with the great, amazing minds that are involved in this whole area of biotechnology, I'm sure that and probably so much more is going to be coming to the forefront. And it's really exciting to see where the leaders in the science and medicine and understanding the medical health applications are really coming together with the biotechnology side of things and looking at how these converge and how these meet. And they're solving a lot of problems around the world, and it would be fair to say we do have a lot of problems around the world that need to be solved, especially at the moment with the epidemics of chronic disease that exist. I've used these statistics a lot on these series, but over 3 billion people in the world currently suffering from pain and disease as we speak. It's almost half the world's population. It's just crazy. And if we can start to understand more about these scalable, accessible technologies that are now available, and again in a very inexpensive sort of way, we can start to navigate towards understanding a lot better about ourselves and what's right for us to be able to have better conversations and give better outcomes for people. So I really see this as such a valuable conversation, and thanks again for your time for being here, Clint. We just got. I'm just going to keep jumping to these questions. We've got some great ones coming through. Ruth just asked, do you see this ever being learned in early schools? Should children be learning this along with maths and science to reinforce the importance of our health to our learning and then our wellness to society? Have you got some insights there, Clint, just from what you've observed in your time in technology, from over the years to how we are where we are at this point in time, what's coming in the future? Is this something that we really need to be considering, biotechnology as more of a part of our life and maybe integrating our whole learning and whole system? Love to hear your thoughts there.
Absolutely. I think that the child obesity epidemic alone should teach us that we need to start teaching this within school. And there actually was some improvement made under Michelle Obama's plan very early by just putting healthy food into schools. The child obesity rate went down. One of the first indicators I've seen in the world where we actually got better at something. But yeah, I think absolutely we should learn our numbers very early on, because we creep into these disease states. We creep into hypertension and we creep into diabetes. And in some cases it's too late. Sometimes it goes undiagnosed. When we say there are X million diabetics, those are the diagnosed diabetics. How many are already there and how many are going to get there? So I think that we need to teach people about nutrition, about manufactured food, and about fitness and just activity, just getting people to move. Sitting too long has become a huge issue. When you sit for too long, you create these chemical reactions as well that are very dangerous. So yeah, I think this should be taught to children, taught within the educational system.
Well, thanks, Clint, and I certainly echo your viewpoint there. And I think that the more aware we can become early of these sort of concepts and understandings, the more chance we have to actually engage in a great conversation and engage in a very empowered state of health. And that really is, again, one of these exciting things that are coming with this biotechnology. We've got another question here. Again, I'm just going to jump to these because there's so many great ones coming through. Clint, do you envision these technologies going from wearable to something that's always attached to us, like a tattoo on our skin? It's a really great question, and yeah. Probably got some insights there. So, Clint, if you'd love to jump into that one, I'd love to have that conversation.
I think that is on its way, and also the concept, if you're good enough about over a long period of time wearing these devices, even occasionally. Not even 24/7, 24 hours, 24 hours a day. I think that simple applications like that will come, and who knows, maybe we'll get implantables after a while, so that you don't have to. That they use energy harvesting from your body temperature. Yeah, I think all of those are a possibility.
That's awesome, Clint. Thanks for sharing. I know there's certainly been some, or not even a dream or things that are coming soon. There's prototypes that exist. I know, for the skin tattoos that are actually out there already. That are measuring these biometrics data and looking at heart rate variability and skin temperature and all those sorts of things. And touching on what you said before about blood glucose, I believe, I can't remember the name, but very recently there's people out there now that are looking at measuring blood glucose through the skin with some of the things that exist. So off of your smartphone. So it certainly is an exciting time. There's a lot of amazing advancements coming that are really, really exciting. And it's a great question about that. And I don't know, even further down the scale, which may be exciting and scary at the same time, is a lot of implantables, as you say, the nanotechnology that can actually get injected into your bloodstream, can follow around and really help diagnose a lot of the conditions that are happening from a chronic disease state.
Right. Yes.
This stuff is in prototype stages. It's being looked at medically at the moment in trials. It's all coming, and it's coming fast. And it does bring a good perspective to the conversation of where we're at in the world at the moment. Because in some conversations we do talk a lot about moving away from technology and getting back to nature and being more mindful and conscious and present. Yet at the same time, this technology is coming whether we like it or not. I think Lady Gaga is going to be having a show in space at some stage in the near future, and all these sorts of things are happening. Technology is so advanced right at this point in time, and it really is just an exciting time to be witnessing this. But more importantly, I'd love to sort of extend to everybody listening to this that it's an exciting time for us to be very open and aware of what's possible and how we can harness this for the greater good. How we don't have to sort of have the right and wrong, or the east versus west, or all these sorts of things we've had in the past where we're sort of butting heads and we're pro-tech or anti-tech, and we can actually just say, oh cool, well it's coming, it's here, there's so many benefits from it, we're so connected, we're able to help so many people with their health now. How can we harness the power of this for good? How can we use this information to understand more about ourselves, to actually be in a space where we can have a conversation about our mental status, about our emotional status, about our physical status, and start to shift towards where we need to get to on the health scale. So I really do enjoy where we're at this point in time, and I'm excited for the future. And as you know, Clinton, probably everybody by now knows I like to talk about the future a lot, and future health and future medicine. And we talk about it's not too far in the future the way we're going to be. We talk about Siri and Siri's bigger sister Holly, I call the hologram, where you'll be able to sort of when we have credit cards and things like that available that are our phone and are our ID and all these sorts of things mixed in at once. There'll be a hologram that you can talk to, and it'll interact with you. You can breathe into it. It'll diagnose based on your breath what issues you've got. Naturally 3D print all your natural medicines for you, and then monitor your biometrics and manage all these sorts of things with you. This is the sort of future that's coming with technology, and it's not so Star Trekky anymore. Right. It really is quite crazy. So it's an exciting conversation, and I'd really encourage people to embrace the position that we're in right now, and see if we can work collaboratively as we move forward. Because I know these conversations are going to be coming very strong and become very political as we traverse over the next 5 years. But it all just starts with knowing more about yourself, and that's really everybody listening to this conversation right now can just harness the fact that you can know information about yourself, you can be aware about your current health status, and you can do something about it. You have a choice. And again, go check out indiehealth.com where you can find out just a simple activity tracker, and you're off and running. So it's literally speaking. So it really is exciting time. So Clint, have you got any thoughts or comments on those ramblings of myself just then? I'd love to hear just a bit from you on that.
No, those aren't ramblings. I think that the world is shifted, and there's an industry built on us being sick, and we have to get around that. And the way we get around that, it has to be upon ourselves to do that. We can't rely upon institutions to help us. So you're absolutely right. And I like that the mindfulness is so important, because there are more and more studies tracking mental health to your physical state. A bad mental state will, almost by definition, it won't help you, certainly, and it could be detrimental. So that's the next frontier, is how do we tie those together? How do I begin to get healthier by improving my mental health? And in most cases, it will be improving my physical fitness, my physical shape, but how do we get those two together? And it's up to us. That's hence the idea of indie health. It's the individual, it's independent living, it's individual empowerment. It's us that needs to solve this.
Beautiful, Clint. Thank you for sharing that and echoing the comments. And we've got just a couple more things, particularly about the schools. There's a few comments here, and Jeff says about speaking of the schools, so many times there are children who need aids with them to observe their behaviour. Do you think there could ever be a technology that could help these children who may need all this extra help, perhaps recognise where there is a chemical imbalance that affects their learning, or any other insights like that? Do you see any more applications like this coming, or have you heard about any of those, or just again interested in your thoughts? Thanks, Jeff, for the question.
I haven't, but in back to the thought of using existing technology, what you could do is potentially use an activity tracker with heart rate variability, and from that begin to pull out enough information to know their state. and to use algorithms. If you realize that they're doing well and they're studying when they're in a certain motion, which probably is very calm, that's great, low stress levels. So from that perspective, maybe we can use off-the-shelf technologies to redefine the application. And I think that's been my philosophy, is what can we take that's off the shelf and what's good enough? What can give us that indication? So that would be a way where I would want some clever application developer and some clinicians to look at off-the-shelf technologies and how they might diagnose that. We need indicators, then we can dig deeper on that.
Yeah, great. Thanks, Clint. And I'll just add something a little bit to that, Jeff, as well. That we've been involved in research that where we're looking at different children in classrooms and looking at some of the actual brain tracking, EEG devices as well, that can help understand which kids are very focused on the teaching at the time, which kids are very distracted and maybe passing notes or very, very bored, and looking at the actual teacher and what they're teaching at a particular point in time. And it's a very interesting time. We're understanding more about the brain and more about how this works, and more about even our teaching methods and engagement styles in the classroom, as to how is it actually the teacher's method that is engaging for students. Because sometimes where we are maybe just sitting there writing boring things on the whiteboard, there's a lot of students that find that way of learning very interesting and engaging. There's others that find it very distracting, that we may label with ADHD because they're just bored and they're not stimulated. They're off doing things that are more entertaining for their minds. So maybe before we can go and medicate those children, we can consider maybe the learning style is actually not appropriate for them. But it means that we can actually look at as we talk about the data here, we can look at the whole class. And is it the whole class that's not engaged because it's the teaching style, or is it just one or two kids? And maybe there is something we need to look at more in those kids. So there's a lot of great study that's being done, a lot of great research that's being done by a lot of people all around the world in these areas. It's still early days with the data to come out for it, but the applications for this is great. And I certainly echo from what Clint says. A lot of the Star Trek style things are things that are going to improve in the long term. But right now, the off-the-shelf things are just so important to get a handle on and say, what can I just grab tangibly right now? What exists out there? What can I actually measure on myself? Where can I start? And how do I get out there and get moving? Or how do I understand the application of this for my sleep, for my health, for my stress, for my foods, for my climate, what I do with my time, all these sorts of things that really influence our health in such a great capacity. And again, the concept of personalized health, the concept of epigenetics, as we talked a lot about on this summit series as well, is really helping us understand more about who we are, what's right for us, and how unique we are, choices to move towards a place of health. So, excuse me. So
on the forehead or wherever it might be for EEG. With Bluetooth Low Energy, so you can passively collect that. So that would be there. You just invented a great new sensor that I haven't heard of yet, but that would be wonderful information to pull off.
That's great, Clint. Well, hopefully you can take that and run with it, or someone listening to these calls can, because this is all about improving humanity, and it doesn't matter who gets there or who does it. It's about making sure that we're all winning the race. Everybody on this planet's benefiting from all this great technology that's coming out. And once again, Clint, I know you've been leading this way for decades. So please go on and check out more of Clint's work. Please go and check out to indie-health.com to find out more about that and how you can get started in this area if you're not already. And share this sort of information with friends and family, because it's so important. We're just going to jump to an interesting question from Ekaterina here, who says, Clint, what does this all mean for our intuition? Do you think it will enhance or take away from our ability to know about ourselves, without referencing numbers or anything like that? Just again, interested in your thoughts as to where we go, and maybe just to sort of paraphrase that for everybody listening at home. We sit here, we have our thoughts, we make decisions. Is there technology that's going to sort of take over and grab our thoughts out, tell us what to do, and suddenly our intuition, it's almost mimicked by technology? Where is this going, and how crazy can this conversation get? What do you see sort of happening in the future of the mind, and what's going to be possible in this space?
Interesting. So the way I would look at it is that this new technology we're talking about with the sensors to get biometric information won't replace your intuition. It'll give you a baseline. So then when your numbers are good and everything looks good, you feel good, then your behavior might change, and you might not need them as much as you did. But right now we don't know what we don't know. So I think the initial push with technology will be for us to learn more. And then when we get that baseline and we get our activities in line, nudged one direction or another to help us, then I think your intuition can kick in again. if that makes any sense. Because we might have gotten to a physical state right now or a mental state. We don't know how we got there. So let's get back out of it and learn how we did that and what the baseline is. And then I think intuition kicks back in.
Beautiful, great answer. Thanks, Clint. And Clint, just in terms of the global scale here, because I know that you work internationally, and just to understand, are countries really adopting this and taking off with it? Is this being widely used in any countries? This new technology, the medical and health applications of it. Is there a lot of countries that are for it or against it or behind the times, or some leading the way? Could you just give us an insight around the world? I know you do travel to a lot of different conferences and events and speak on stage a lot. Can you just give us an understanding for those listening in right now, where is this technology if we haven't heard of it, and how prevalent is it, and where's this sort of expanding big in certain countries?
Probably some of the most advanced countries or regions would be, as far as the governments go, would be Scandinavia and Singapore, where they have nationalized health services that want to keep people out of hospitals. They literally want to build fewer hospital beds. What the technology is just catching up to the price points they want, but also it takes time for these governments to put tenders together. So I've been working in Scandinavia for probably 3 years. I think once again, 2016 will be the year that they pull them together. And I think a lot of other countries are watching them. And once they prove it, you'll see countries like Brazil and others that are very forward thinking begin to pull up on this. But the big country that I'm pleasantly surprised with is China, in that there's a huge effort in improving public health, and even from the corporate side, there are corporations that want to invest in keeping people healthier and at work and out of hospital because they pay for the hospitals. In the U.S., there are pockets that are beginning very progressive, just pockets. Overall, the way the U.S. the general way the U.S. healthcare system is designed is that hospitals make money when you're sick. Doctors make money when you are sick. So there's not much incentive within that structure, but there are something new called accountable care organizations from Obamacare, where these companies, these entities are now being implored to keep people healthier longer, keep healthcare costs down. So we're beginning to see agencies, even new agencies are coming in, seeing this as a new business model in the US, where they will take over a population, they will manage that population. So I just heard that yesterday from one of my other partners, or this morning, that they're pleasantly surprised about this movement. So you're not going to see it from the mass market yet, but you will see agencies doing it slowly but surely. And then I'm working with partners through distribution so that we can get out to Walgreens, to CVS, and to others, and bring solutions through them in a scalable fashion. Part of the problem is this hasn't been scalable from a technology perspective. You can't go into any corner store and see these systems. So I have many partners that are working with the Indie Health Kit and what we're working on to get those distributed and to make it easy. So again, I think it's, everyone always says that this is the year, but I was with many partners who really are pleasantly surprised at the interest and the number of orders they're getting. And we're still in the thousands. We are not yet in the tens of thousands or millions. This reminds me of the early days in cellular. I put together a US forecast with 1.5 million digital phones in the whole country. 1.5 million. They sell that every hour, or not every hour, but every week that much is sold. So we're just at the beginning days with technology we all know is going to be useful, but it's a matter of scaling it.
Yeah, beautiful, Clint. And if there's anyone listening to this right now who's interested in this area, or has friends or family working in this area, please go and check out Clint's work that he's doing. It's amazing. indiehealth.com, you'll find out a lot more information about the actual trackers that are there. Clint, I just want to visit one last concept here, which is always fascinating for me, the concept of the smart home. And we talk about things that are coming in the future. We've talked a lot with some amazing experts in leading the fields in nutrition. This time we've talked a lot about the microbiome, which is the best way we can actually find out about the microbiome is to do a stool sample. And we talk about smart toilets now, where you can actually go to the toilet and it will collect your stool sample and measure your microbiome and measure the different levels of certain microbiomes that you've got going on through there, and be able to give you information. This is obviously not available just yet, but this is future talk and stuff that's being prototyped. Smart fridges, where you won't be able to know if you've got low on carrots or out of celery or tomatoes, or even having rewards and incentives attached to if you've got junk food or good food in the fridges. Walking into your house and the temperature changes or the lighting changes or all these sorts of things that happen. according to the information it picks up on you personally. It really is crazy as to what we're thinking about that's coming in the future. And I'd just love to get your thoughts on, when you see this coming. I know you're very aware of these sort of concepts and the sort of conferences that you go to that talk about a lot of this sort of stuff. A, can you give us an insight? This stuff is happening, but B, when is this going to be hitting the shelves? As you say, it's hard enough to help people understand that there's activity trackers available to help where they're at this point in time. How far away do you see these smart homes when we just walk in and things are there for us and things are talking to us and whatever else without us even thinking?
I think we're probably pretty close, and if we don't see it here yet, we'll see it in Japan and some of the other countries in that direction. I know that speaking of along those lines, in Japan, they're working with the elderly with robots and electronic pets that move around the home and actually keep these people company. So we definitely know that putting smarter and even intelligence into the home and devices will improve people's levels of health. And to your point about the smart refrigerator, diet keeps evolving so quickly. We're learning whether people are gluten intolerant, whether not, whether something's organic. To be able to tell as we keep learning about diets, what's important is one good way. You just made me think about this. That's one great way to use the smart refrigerator and some of the smart components in the home. What does this look like today? What new is coming out, and how can I keep up with that? Absolutely. And the smart toilet. It's funny as that sounds, that's a great indicator of what you're well, it is an indicator of what you're putting into your body. It is the main indicator. So you can learn a lot from that. I hadn't looked into that in depth, but I've known for years that there are ways you can look at what's going on and see what's good or bad. So that's a great, I think that it will come. And again, it has to be passive, and there has to be information that comes to us automatically. That's the key.
That is the key for the tech, absolutely, Clint. And we've got a lot more questions, but unfortunately we're out of time today. Clint, thank you so much for joining us here. Thank you so much for sharing all of your amazing information that you have, what's happening in the world of technology, the advancements in biotechnology, where things are at. And I guess the most important message out of all of this, if nothing else, is the fact that this exists right now. There's off-the-shelf solutions. You can walk in, you can go to indiehealth.com, you can get an activity tracker or something for a very, very inexpensive amount, and you can start to find out and be aware of where you are right now at this point in time and what you can do to transition towards a state of health. So, Clint, I really thank you for your time. Really appreciate all the work that you're doing with all your colleagues in the industry, and thank you so much for that. Everybody else listening in today, thank you so much, whether you've been here live or dialing in, watching replays. Really appreciate you investing the time into your own health so you can start to harness all this information to make a decision and find out who you are, what's right for you to be happy and healthy. Please like the Facebook page so you can get all the updates, the goodies, the speaker schedules, everything. And most importantly, please subscribe to the YouTube channel so you can get all the free video replays from all of our speakers sharing all this amazing content just for you. So thank you. Please share this with your family and friends so that everybody can benefit. That's why we're all here. Clint, thanks again, and thank you all for being here. Look forward to talking again soon.
Great, thank you.